during pandemic. This is very concerning, and several factors have been recognized which contribute to these tsunamis. Those are as follows, like high number of category 4 and 5 COVID patient ICUs, and because of that require a lot of antimicrobial as their therapy. And we know that to get the pathogen, in terms of bacteria or viruses, other viruses from their sample is quite difficult due to the infectious condition, right? Especially those samples from the tracheals. So clinician, they normally treat the patient in a broad-spectrum antibiotic, which is also quite tricky and dangerous. All right, and these patients also require longer hospital stay, which also contribute to the presence of antimicrobial resistant pathogens. Yeah, and the other factors that contribute to these tsunamis are actually a lack of staff and PPEs. Yeah, and the use of aggressive use of disinfectant to decontaminate surfaces. Yeah. And I would say tsunami of AMR is an inevitable encounter, and it's a kind of vicious cycle because there will be increased antimicrobial consumption for these patients, okay? And at the same time, it will lead to increased number of antimicrobial resistant pathogens such as MRSA and Helicobacter pneumoniae.
Is caused by a human coronavirus called SARS-CoV-2. It is the number 7 of coronavirus infecting humans. Coronavirus divided into 4 different types, namely alpha coronavirus, beta coronavirus, gamma coronavirus, and delta coronavirus. SARS-CoV-2 belongs to beta coronavirus, and there are 5 members in this group. We would like to test the anti-coronavirus properties of our product. However, due to strict requirement to grow the SARS-CoV-2, we decided to use another beta coronavirus, which is in the same group with SARS-CoV-2. Human coronavirus OC43 is our choice for this preliminary testing. The result from our preliminary testing show our product has some degree of antiviral activity.
Nanomedicine strategies can consider a powerful tool to enhance the effectiveness of antiviral drugs, which often associated with their solubility and bioavailability. Okay. One of the nanomedicine strategies here is by encapsulating antiviral agent in nano-emulsion as a delivery system. Nano-emulsion as emulsions consists of oil and water which is stabilized by a spectrum with a particle size below 500 nanometer. There are many advantages of nano-emulsion as a delivery system or vehicle, such as high encapsulation capacity for hydrophobic drugs, great physico-chemical stability, could improve bioavailability, and the drug pharmacokinetics can enhance the solubility and absorption of bioavailable molecules. So due to their characteristic size, usually it appears as transparent or translucent to the naked eye. So it has the capacity to dissolve hydrophobic agent and good compatibility, which make it an ideal vehicle for antiviral formulation.
Based germicide agent for decreasing infectivity, morbidity, and the rate of mortality associated with microorganisms, and pathogens. Our lab testing at Medical Faculty of UPM had shown that the product is effective as antibacterial and antiviral agent. It is a nano-emulsion with a nano size of less than 200 nanometer. Our storage and stability study has shown that the product is stable and remains active after 6 months when stored at room temperature. The operational process is green synthesis, simple and affordable. The product formulation is made from 100% food ingredient, thus giving the minimum toxicity, gentle to the skin, and biodegradable. The lemon scent of the product eliminates the odor and keeps the rooms of treated area as fresh, clean, and bright. The product is suitable to be used as surface decontaminant, such as in the hospital and any healthcare facilities. It also can be used as non-toxic, non-alcoholic, and biodegradable hand sanitizer.